Aging, a brief pathophysiologic review. There are certain common characteristics when we talk about aging. The first is, the older we get, the closer we are to the end of our lives. There's biochemical changes in all of our tissues. We have a decreasing physiological capacity. Our body just doesn't work as well as it used to. We have a diminished ability to respond adaptively to environmental stimuli. And we have increasing vulnerability and susceptibility to disease. All right, first let's look at fluid and electrolyte changes. As we age, we have less muscle and more fat in our body. Now there's less water stored in fat than in muscles, so we have less body water. That's less fluid inside our tissues. That's less fluid to call on in times of stress. Also, our kidneys have a decreasing ability to regulate sodium and water balance. Put these factors together, we have less total body water, and we've probably got some electrolyte imbalances, or we're very prone to them. So as we age, we have increasing vulnerability to dehydration. Changes in immunity. With age, there's a slower and less vigorous response to pathogens. The immune response just isn't as strong and doesn't jump in as quickly. There's also an increase in autoimmune responses. So there's an increased incidence of all those autoimmune diseases, such as lupus. There's an increased hypersensitivity responses. So as nurses, we need to be aware that people are going to be having more drug allergies and more mental allergies, and perhaps more severe responses to these. As we get older, there's an increased risk of cancer. Remember, we think there's a strong genetic link with cancer, and it's linked to genetic mutations. As we get older, there's more and more of an accumulation of these mutations. And the body isn't capable of repairing the DNA quite as well as we get older. We also have been living in our environment around the carcinogens longer. And there's an impaired immune function, impaired ability to fight off all of this stuff and respond appropriately. We have changes in neurological functions, cognition, sensation, pain, and also our motor responses. As we get older, there's a decreased brain mass. Remember, when brain cells die and when many of the nerves in our nervous system die, they are not replaced. The decrease in number and function of neurons occurs. There's a decrease in myelin. Remember, myelin helps us to have fast, smooth transmission of neural impulses. And as that myelin starts to go away, we have less smooth responses, so we get less smooth movements. And there's a change in neurotransmitter production. So messages can't be sent back and forth between the brain and body quite as effectively as we age. There are changes in mobility, secondary to changes in the neurological functioning. If the brain can't send smooth messages back and forth, we're not going to be moving quite as smoothly. But there are changes in the musculoskeletal structure, such as bone loss. With age, we have bone loss in the spine, among other places, and kyphosis develops. That's the exaggerated anterior concave curvature of the thoracic spine that you can see in this picture. With bone loss, we get fractures of the vertebrae and hip. Remember, bone loss makes the bones less dense and more fragile. It also means that falls are much more devastating. They're more likely to cause fractures. With age comes sarcopenia, which is a loss of skeletal muscle. And this is made worse by decreased physical activity and the changes in the nervous system, and also not getting enough protein to eat. The cardiopulmonary changes. There's decreased elasticity of the smooth muscles in the heart and the blood vessels. That means there's impaired cardiac output, and there's also hypertension. Remember, the decreased elasticity of the arterial connective tissue means there's increased vascular resistance. Overall, there's impaired perfusion throughout the body. In terms of the lungs, there's decreased elasticity of the pulmonary structures and decreased capillary density. So the lung and its structures, such as the bronchi, are less elastic. They don't dilate and constrict as readily. It's harder for air to get in and out. Also, there are fewer capillaries around the alveoli in which to exchange gases, have that oxygen carbon dioxide transfer, diffusion happen. And there's decreased oxygenation to the tissues. Metabolic change. Generally, everything's slowing down. Metabolism is slowing down, and that influences the rest of the body. Decreased metabolism means it's easier for obesity to occur. There's altered digestion and absorption. Nutritional imbalances and deficiencies because we just don't absorb as well. With these nutritional imbalances and deficiencies, we may see cognitive impairments, increased risk for infection, anemia, and poor wound healing. Because metabolism has slowed down, people don't need as many calories. However, we find that a significant portion of the population doesn't get what they need. Even though they need less, they're still not getting what they need. If obesity occurs, it puts a further strain on the system, an already strained musculoskeletal system, cardiovascular and pulmonary system, and endocrine systems. These systems are not jumping back and responding as quickly as they were when somebody was 35 years old. Now they're having to carry around all this extra weight and burden. That makes it even easier for someone to get sick and have further problems. Changes in the neuromuscular system leads to slower GI functioning. That means decreased peristalsis. So we see constipation and fecal impaction occurring more frequently. There's also functional incontinence because of these neuromuscular problems. They can't get up and as quickly and walk as quickly and manipulate their clothing as easily, so we get that functional incontinence occurring. The changes in absorption puts the elderly at risk for diarrhea as well. However, this is less commonly occurring than constipation in the elderly. Renal structures change. There's a decrease in renal blood flow. Remember, we said there's decreased perfusion and decreased oxygenation. That includes in the kidneys. So there's decreased functioning of the nephrons. There's also fewer nephrons. There's lower renin and aldosterone levels. The kidneys can't concentrate the urine as well. That means they're putting out more fluid. Fluid is not being reabsorbed back into the body as it is needed. Again, increased risk for dehydration. And the kidneys don't excrete drugs well, so they build up in the body, and we have increased risk for toxicity in the elderly.